What is polycystic ovaries, or what are the symptoms to understand if you have PCOD or PCOS? A lot of young women these days have PCOS or PCOD. Well, first symptom, you should not have any acne if you're 21 years of age. And if you're still getting pimples more than 1 or 2 around your periods, this could be an indicator that you have polycystic ovaries. Second, if you have thicker hair on your upper lip, on your chin area, coming down to your neck, on your sideburns or certain body parts, this could also be an indicator of polycystic ovaries. Third, if you find that you're gaining weight easily, but you're finding it harder to lose the weight, this is what we call as insulin resistance. And this is another indicator of polycystic ovaries. The fourth indicator for this is thinning of hair. A lot of young women experience not hair fall, but thinning of the hair, where the hair is thinning in this part of the scalp, the frontal area as we call it. There is also receding of the hairline, which is going backwards. If you see these changes, this could be another indicator of polycystic ovaries. So these are the 4 critical signs that you need to watch out for to see if you have PCOS or PCOD. And if you do have any of these symptoms, do consult your doctor right away, because early treatment is best when we're dealing with PCOS. What happens when you have PCOS or PCOD? Well, when women have polycystic ovaries or polycystic syndrome as we call it, there is a syndrome of many things that's happening, but it has to do with the hormone health of our body. And we all know that women produce estrogen, they produce testosterone, we have progesterone, and we have different other hormones, right? FSH, LH, etc. Now all of these are in harmony within our system. When polycystic ovaries takes place in our body, there is a disarray. So this balancing between the hormone goes off. Our body gets into a state of more androgenetism, which means we're androgen sensitive or male hormone sensitive, which is the testosterone, because women produce testosterone and estrogen. And when we get these sensitivity, right, to the androgens, it starts expressing itself. So you start seeing all of the signs of polycystic ovaries that takes place. You can have increased oil secretion on your face and your scalp. You can have increased hair production on the upper lip, chin areas, sideburns, etc. Thinning of the hair in the scalp, easy weight gain, also mood swings. And eventually, when it's not treated, these can lead to infertility or hard to get pregnant also. So it has a lot of health issues. So it's important to get your polycystic ovaries looked into. Home remedies, DIY tips, etc. will not help. This is a medical condition which needs treatment. And why am I talking about this? Because I see a lot of people who DM me asking for remedies for PCOS, and I'm always telling them this is one thing where you need a detailed history, a medical consult. It involves an endocrinologist or a functional medicine specialist, a dermatologist for all of the other expressed androgenetic symptoms, and a gynecologist if you're trying to conceive. So these are the few things you must look out to. And if you're having missed periods or missed cycles especially, then definitely go see your gynecologist for your PCOS. There is no need to be scared or to be fearful if you've been diagnosed with PCOS or PCOD, polycystic ovarian syndrome. The reason is it is treatable and it is manageable. But one thing you must realize is PCOS or PCOD is what we call as a lifestyle disorder almost. It's like diabetes in some ways. You know, once you get a PCOS or PCOD and you're symptomatic, it can be pulled back so that you become asymptomatic and all of the signs and symptoms can be controlled. But your body now is sensitive, and it's always going to be sensitized to being in a state of PCOS or PCOD. So you need to manage these with lifestyle changes. Your doctor will definitely medicate you if there are perceptible changes that are taking place, so that we can control the symptoms and get you back to a non-symptomatic PCOS. The non-symptomatic PCOS can be easily managed by yourself by diet modifications, by exercise. At least 30 minutes of exercise on a daily basis should become a habit, and also knowing and understanding your body and its symptoms. So there's no need to be scared if you have PCOS or PCOD, and there's no need to be scared to going and seeing a doctor to get this diagnosis, because it can be managed.